healthcare professionals, we need to be sensitive to how different individuals and communities' values and perceptions about healthcare differ from our own. And in that regard, we need to have really very appropriate and effective communication. And this is a two-way type of communication. We need to be able to listen to our patients, to really understand what's going on with them. How do they think what happened to them happened to them? What do they think would be helpful in improving their health situation? And then as we're providing information and services, we have to be sure that they're provided in a language that's appropriate for these individuals. And then also at a comprehension and literacy level that's appropriate for these individuals. And then also that it aligns with their cultural beliefs. And so that we're really partnering with our patients and clients so that we can work together with them to solve their healthcare issues and situations that they find themselves in.
I think cultural competency for a healthcare provider is being aware that you need to ask the right questions and find out what's important to the patient.
And I think cultural competence is a lot about just building relationships with other people. I mean, we can teach students, okay, within this particular culture you may expect someone might behave this way. But we have to be really careful, because if we start stereotyping individuals, we're not allowing for, there's so much diversity among culture. And it depends on how long someone has been here in the United States, their education. And so if we approach the person as an individual, develop the trust, develop the rapport, I think that's where it starts. It helps to know a little bit about background, cultures, and information, but we have to be careful with that.
You are working with the Burmese refugees, then you can learn about what's the situation locally of what, where they're living, what are their sort of historical sort of resettlement happenings in the last when they started to emerge in this particular region, and what are their sort of the social political challenges that they have to go through in order to get here. So those are the pluses. I think the minuses can be sort of come from the same sort of ideas, that in doing so, doing sort of background research before you meet the person, you may be creating sort of a biased idea about who they are. So it's kind of double-edged sword, I think, in many ways, that you do want to have as much information as you can about the person, but at the same time, you don't want that to cloud your judgment, the clinical or practice-related judgments about who they are individually.
I think cultural competency from a healthcare provider's perspective, as I said before, is being open to what's important to the patient. And I don't know that we can ever be completely culturally competent. I know as my career has taken me to different cities in the United States, you run into different populations. Just before I came to Buffalo, I was in South Florida, so we had the Haitians and the Jamaicans and the Cubans, which is very different than what I'm seeing here in Buffalo or what I saw in Virginia where I was before Florida. So I think part of cultural competency is being aware that people's culture is important to them.
When I first started teaching at the university, one of my colleagues talks about, he was a clinician, and he talked about clients looking at us with big eyes. So they're evaluating us too, just as we're kind of assessing them. They're assessing us. They want to know, they're assessing us, are we genuine? Are we honest? Do we really care about them? Do we really have their best interest at heart, or is this just a job or something that I'm supposed to do?
I'm going to use rehabilitation as my example. So here in the United States, we're very independent. Independence is valued. So we teach individuals how to become independent, and that's our goal. So we use many outcome measures that measure their amount of independence. But we may meet an individual from another culture where that is not considered a priority. They consider it more important that their loved ones help them. So here we are trying to teach someone how to get dressed, and the family does it for them. So what do? Tell them that, no, that's not right, that's not the way. We find an area where they want to be independent in, that they want to grow in, that they want to improve in, something they desire to do, and we meet them there. So I try to tell my students that we have to meet the individual at their level and find out what their goals are. Or we're not going to motivate our patients at all.
If they can't connect with you, there's nothing in it for them to follow through. So if I can't connect with you, why would I care if you referred me to a cardiologist? Because you're just trying to make some money for somebody else anyway. You're not really all that interested in my health care.
We are the individuals, the therapists, that end up treating individuals that haven't received consistent health care throughout their life. And the health care that you receive even when you're a child can affect you throughout your whole lifespan. I think this is really important for us to understand when we go out and we provide services, and that we need to not judge the person for the condition they're in, because we have no way of knowing how much information, how much knowledge they've had, what their resources have been. We have to deal with the here and now and what their condition is presently and try to bring them along as best we can.
The importance of really understanding the power of cultural sensitivity was really exemplified recently when a student shared with me an outpatient experience that they had. So a male student was examining a patient who had a shoulder problem, and this required the woman to remove her outer clothing. They were in a private room, and but this woman's religious beliefs prohibited her from disrobing without her husband present. Mm-hmm. And so when the student understood this, they welcomed the husband into the examination room, and throughout the examination he could see that the patient demonstrably became much more cooperative and calm and appreciative of the fact that the student had respected her cultural beliefs and practices, and that really contributed to the development of a team and to the effectiveness of the examination and subsequent intervention.
I had a very Orthodox Jewish couple once. They delivered triplets just before whatever the big high holiday is in the fall, and you fast for 24 hours. This woman was breastfeeding her triplets and fasting for 24 hours. Well, needless to say, the hospital staff was just up in arms. You can't do that. Well, if you think about it physiologically, 24 hours, if you're an otherwise healthy person, isn't really going to hurt you. May have decreased the amount of breast milk a tad, but not significantly. She was fine. Those 3 babies were fine afterwards. But nobody wanted to understand that this was really important to this couple. That was their religion. Those were their beliefs. That's their culture. That's the culture these 3 children are going to be raised in. We need to say, explain to me why this is important, and they did. I mean, she gave us very detailed of why you fast, and it's like, oh, that's interesting, and okay, and what can we do to support you during this next 24-hour period of time and your babies?
Many times within the refugee community, there will be individuals that have suffered traumatic, incidences in their country, and they've experienced a lot of trauma. And they may be feeling very depressed, very anxious, but they really don't know how to express it. And so this physician told me about a woman that he was treating, and she was from one of the African countries, and she had all these physical complaints, and they just did all these tests, and nothing came up, and they do more tests, nothing came up, and he knew the real problem was depression. But in her language, there was no word for depression. So he worked with the interpreter, and they worked on this for a long time, and they finally came up with a phrase, "to break my heart." And once they came up with that, the woman acknowledged that's how she felt. And they were able to treat her, and she improved. And so look at how long it took for them to get to the root of that problem. But in the end, there was this successful outcome.
And I know that just from my own personal experience, growing up as a young lesbian, it was always very risky for me to go to healthcare providers. It feels less risky now because I think there's a lot more knowledge and awareness out there about gay and lesbian people, bisexual people, transgender people, and I think there is more acceptance, though of course it's not universal. But it was always risky to go to healthcare providers who would then of course make the assumption at the time that, oh, everybody's heterosexual. And I think probably most lesbians of my age, and I'm not going to tell you how old I am, but most lesbians of my age probably have some funny stories and perhaps some not so funny stories about going to the gynecologist. You know, we have stories about going to the gynecologist for the first time. And of course you have the intake form. Are you sexually active? Yes. Are you using birth control? No. Are you trying to get pregnant? No. And then of course we would be asked about that. And I would then of course have to say, well, I'm a lesbian and I'm not being sexually active with men. And sometimes though, to put a little humor into the situation, I would either write on the intake form or I would say verbally, oh, I practice lesbianism, which is the best form of birth control.
For me, that cultural humility, that cultural engagement, it's all about genuineness, it's about honesty, it's about people seeing you for who you really are, and understanding and feeling that you care about, you honestly care about what's going to happen to them and for them.